I'm Dr. Robert Flemming. I'm the Director for Transforming Clinical Practice Initiative.
Good day. My name is Fred Butler Jr. I am a Lieutenant Commander in the United States Public Health Service, and I serve as Senior Advisor for the Transforming Clinical Practice Initiative.
What we're testing, of course, is how we're able to provide targeted technical assistance across the nation to a sample of clinicians that are not just the traditional MDs, but also across the board with nurse practitioners, PAs, and the like, to actually offer more quality improvement, better person-centered outcomes, and of course, cost savings to the government.
The basis of TCPI is founded in transformation, in the phases of transformation. There are a number of different areas that the clinicians are moving through in terms of their quality improvement. We're beginning with an assessment and reassessing over time to ensure that they are meeting those components that will make them successful in advanced payment models.
So the other part about this is very, very exciting. Where we're at right now, again, year one down, results are very, very important in a model that is looking to actually scale potentially over the next few years. The whole idea behind a model is to test change and to see real positive impact. That positive impact is cost savings, quality improvement.
Absolutely, and I think, Rob, as a part of that data, what we're doing is we're using the quality improvement approach to make sure that we're working with the infrastructure that we have, which consists of 29 practice transformation networks, 10 support and alignment networks, 2 new support and alignment networks, and a host of support contractors. As a part of the quality improvement process, each one of those components is really an integral part of our infrastructure to have small tests of change occur at the local level and to guide that change from the national perspective.
Queen QIOs right now have been really essential to assessing practices, particularly at the baseline, to see where the change can occur on quality and can occur on cost savings. And we've been effective, I think, so far. Still more to be done on these assessments, but it's central to what we're trying to do as far as assessing and reassessing throughout the next 4 years.
Absolutely, and I think a part of that assessment is really seeing where they are with their actual plan for improvement, moving from that plan to setting aims to establish goals, and then having those goals have benchmark improvement from their baseline. It's really a part of a timeline of improvement that is in a continuous loop of small tests of change. The infrastructure that we have within TCPI, in one of the first ways, is very much so a collaborative effort within the Centers for Clinical Standards and Quality. We're effectively partnering with the Quinn QIOs to work with the practice transformation networks and the support and alignment networks in a number of different ways. One of the ways that the Quinns have helped us in this first year is really supporting the recruitment of clinicians along with the support and alignment networks to bring them into practice transformation networks, and partnering with the practice transformation networks to facilitate the baseline assessment.
We're looking to transform, at the minimum, 20% of the small, rural, and medically underserved populations throughout the United States. Of course, we're only looking at a sample population within our model, but it's really important to point out that that 20% number, and I would say it's a minimum 20% that are already enrolled in our program, they're represented, and the Queen QIOs have a very, very special place in being able to transform in that area. Person-centered care, very, very central, cornerstone is what I would like to say as far as what we're trying to test within this model. I think it's unprecedented what we're trying to do here. We've been talking about this, lots and lots of research over the past few decades on what it means to do person-centered care and transform the delivery system to really impact the person and the family that wants to seek better care and better outcomes for themselves. What does that mean? We're looking to test that throughout the next few years and model that example and scale that in a very national way.
And as we are doing with all quality improvement, we're building on best practices. So within the Center for Clinical Standards and Quality, we've had an opportunity to align with the person and family engagement work that's being done at the center of CMS, align with the interests of our administrator, to take the best practices that have been learned as we've worked with the Partnership for Patients in 3,700 hospitals, measuring improvement in person and family engagement, having patients as a part of the dialogue from the onset. This is all a part of the solution that we're designing. In terms of person and family engagement, we have it as a central component of the TCPI infrastructure and information. The change package, which are small tests of change in terms of the specifics, at the higher level, person and family engagement is one of the key drivers of the TCPI model. As a part of the development of the change package, patients were involved. Patients gave their feedback. As a part of the metrics, we have the person and family engagement as a part of our affinity groups. We're bringing them to the center of this work, recognizing that the work will be much better with their involvement, their support, and their feedback.
I want to point out a few of the strategies we're using to advance person and family engagement that will be measured within TCPI. These include person-centered care at the point of care, person and family engagement in outcomes-oriented improvement work at both the PTN and the clinician practice level, person and family engagement in design, priority setting, sustainment planning at both the PTN and again, the clinician practice level.
The Transforming Clinical Practice Initiative, the PTNs, the SANs, the QIOs, are all a part of the quality payment program and the capacity for us to move clinicians towards APMs. It's important for us to also think about how we're learning from the clinicians that are participating so that they can be successful in the APMs. Another point that we were just talking about, Rob, was how we're working to ensure that the learning continues to evolve. We've just had a very successful Payment Land Summit where we were able to integrate not only the PTN, SANs, and QIOs, but patients, once again, at the center of our work. We also had a tremendous quality conference this year, and the representation across the networks, the collaboration, both in the plenary sessions and in the breakouts. I think it's some of the best that I've seen in the years that we've been here with CMS.
It's all very, very exciting stuff. I'm glad you mentioned the conferences, especially the LAN Summit, which is actually an unprecedented position that we've been put in with what we're doing with technical assistance. Absolutely. Before, very, very focused on payment. Now we have that quality aspect of it that we're injecting into this very, very important summit, and of course the quality conference. Looking forward to even more better ones in the years to come, but this one was just outstanding.
Yes, and we really thank our partners for working with us in building on the results of the model, being able to share what's working in their particular community, being able to partner together. We saw a number of different SANs talking about how they were successful in working with the PTNs, and also a number of PTNs and QIOs really demonstrating how they effectively work together. For example, in defining what the assessment score was for the clinical practice, making that decision together, thinking about some of the environmental or local actions that could help move those practices forward because of relationships that have been established by the QIOs over the decades.
I'm going to put a pin in it. This is central to all this, the relationship and the data-driven transformation. So,
absolutely.
Well said.